joining me. This is Tom Cowan again, and I just wanted to give you a little bit of an update. And the next subject I wanted to address is the subject of masks. And I want to look at this from a very specific point of view from science. In other words, given what do we know based on actual studies of the benefit or lack of benefit from human beings wearing masks. Now, interestingly, there actually have been a lot of studies on this, not in a situation like what we're currently experiencing, but as most of you know, the use of masks in places like dialysis centers and operating rooms have been fairly widespread for many, many years, maybe decades, maybe even a century. I'm not sure exactly when it started. As a result, a number of scientific studies have been done to answer the question, or at least address the question, does wearing masks in settings like the operating room or in dialysis center lead to less disease of the patients who are being treated in these settings? And even though I would admit this isn't exactly the same as the situation we're talking about now, if you assume that people being operated on are vulnerable people, and the people who are the operating team is the other people in their environment, we would, at least if the wearing of masks is scientifically valid, we would expect that the vulnerable people, i.e. the people being operated on or the people in the dialysis center, would actually get less disease if the operating team wore masks and not more disease. So let's actually look at some of the studies and the conclusions of what was actually found in the best scientific studies done to date on the efficacy of using masks. And again, I want to credit Arthur Furstenberg for putting this list together. And let me just read this, some of the conclusions. So number one, in Tuneval's 1991 study, a general surgical team wore no masks in half of their surgeries for 2 years. After 1,537 operations performed with masks, the wound infection rate was 4.7%, while after 1,551 operations performed without masks, the wound infection rate was only 3.5%. In other words, when the surgeons and the surgical team wore masks, they had a 1.2% higher rate of wound infections. 1991 study. Here's a study. Bali did a systematic literature review in 2009 and found that, quote, no significant difference in the incidence of post-operative wound infection was observed between mask groups and groups operated with no masks. Here is another one. Surgeons at the Karolinska Institute in Sweden recognized the lack of evidence supporting the use of masks. They ceased requiring them in 2010 for anesthesiologists and other non-scrub personnel in the operating room. Quote, our decision to no longer require routine surgical masks for personnel not scrubbed for surgery is a departure from common practice. But the evidence to support this practice does not exist, wrote Dr. Eva Selden. Here's another one. Webster et al. In 2010 reported on OB, general, orthopedic, breast, and urological surgeries performed on 827 patients. All non-scrub staff wore masks in half of the surgeries, and none of the non-scrub staff wore masks in half of the surgeries. Surgical site infections occurred in 11.5% of the mask group and only 9.0% of the no mask group. Here's another one. Lip and Edwards reviewed the surgical literature in 2014 and found, quote, no statistically significant difference in infection rate between the masked and the unmasked group in any trials. And finally, in Dr. Zhao et al. Reviewing the literature in 2015 concluded there is a lack of evidence to support claims that face masks protect either patient or surgeon from infectious contamination. Here's the final one. Carreau, in a 2014 review based on 4 studies, 6,006 patients, wrote that, quote, none of the 4 studies found a difference in the number of post-operative infections, whether you used a surgical mask or not. I have also reviewed some of the mask studies done in the current situation with COVID, including one from a study in Nature published in June 2020. I don't have the exact reference at the tip of my fingertip. What was so interesting about this study is they were using PCR tests to determine whether the, quote, virus was transmitted with or without a mask. They were assessing, I believe, the adenovirus, which is a kind of supposed cold virus, influenza virus, and the coronavirus. Now, what was so shocking about this study was they say in the study that we did not assess the infectivity of the virus that was transmitted through the mask or without the mask. In other words, they actually didn't assess or even attempt to assess the very thing that the mask is supposed to prevent, which is the transmissibility and the infectivity of the virus. And finally, at the end, they made what I would consider a startling omission. So they took 4 influenza viral PCR tests that were transmitted through the mask, and they decided to culture them to see if the PCR test was accurate. Only 4 out of about 1,000 samples. And what they found is that 2 of the 4 samples that they tested positive with a PCR test tested negative with the viral culture. And again, leaving aside the fact that viral culture is basically fraudulent science, it is what the virologists use as a kind of gold standard to assess whether the virus is actually there. So essentially what this means is, by their own assessment, in 50% of the cases where they said they found a virus, they actually didn't find the virus when they did a check. And that means the entire methodology that they used is completely invalid. And yet this is a study that is being touted as one of the rationales that masks help prevent sickness in this COVID-19 situation. I think if there's any point I want to make here is a kind of saying that I keep saying over and over again, which was something that the executive editor for 20 years of the New England Journal said, that something like 80% of the studies published in her own journal, the most prestigious medical journal in the world, are either incorrect, irrelevant, or outright fraud. And I'll just leave you with one of my favorite sayings, which is, the trouble with science these days is it's actually not very scientific. So with that, I will see you again. Have a good day.